Hello and good afternoon, everyone. I am Dr. Pranitha Somani. I am working as a fertility consultant at Kamineni Fertility Center. Today, we'll be talking about recurrent IVF failures and what are the various ways in which we can tackle these IVF failures. So, IVF is generally considered as a treatment option after failure of other procedures like ovulation induction and IUIs, that to multiple cycles. So, whenever a couple undergoes an IVF cycle or an IVF treatment, they have a lot of hopes which are associated with the treatment. So whenever an IVF cycle fails, it is very saddening and depressing for the patient as well as the doctor as to why it has happened, and it can have a lot of emotional impact on the couple. They might have a fear of rejection. It might be associated with anxiety, depression, insomnia. So there are a lot of mental problems which are associated with single or multiple cycles of IVF failure. Also, it is very difficult and a very tackling situation for the doctors as well when the cycle of IVF fails. So whenever an IVF cycle fails, the next step is to identify the cause as to what has led to the failure and to rectify it, and then only we progress ahead with the next IVF cycle. So generally, first we'll talk about the IVF cycle or the procedure in short. So the IVF cycle is generally divided into three phases. First is the phase where there is a phase of ovarian stimulation and the retrieval of eggs. Next is the phase of formation of the embryos, and the third one is the embryo transfer. So in the first phase, generally the injections are given starting from the second day of the cycle to the female partner, so that the follicles start growing and the eggs inside them also start growing. Over a period of 8 to 10 days, the injections are given, and eventually under anesthesia, a procedure is performed which is known as oocyte retrieval, and the eggs are retrieved. After the oocyte retrieval, the eventual process takes place in the lab. The next step is the formation of the embryos. So in the lab, in each egg, in each matured egg, a single sperm is injected through a process which is known as ICSI if it is an ICSI cycle, or the IVF procedure is performed and the embryos are allowed to form. So the fertilization is checked after 24 hours, and once the process of formation of embryo has started, they are allowed to grow in the lab for a period of day 3 or up to day 5. So day 3 embryos are known as the cleavage stage embryos, and day 5 embryos are known as the blastocyst. Now blastocyst is considered to have the best implantation potential. So whenever a blastocyst is transferred into the uterus with a good quality endometrium, it is considered to give better pregnancy rates. Now the third step is the process of embryo transfer. So in this, generally the endometrium, which is the innermost lining of the uterus, is prepared for the eventual process of implantation. So initially the estrogen medication is given starting from the second or the third day of the cycle, and once the desired thickness of the endometrium is achieved, which is around 8 mm, eventually the progesterone medication is added, and eventually the embryo transfer is planned. So once the embryo is transferred inside the uterus by process which is known as embryo transfer, the eventual process takes place in the body, where a good quality endometrium and a good quality embryo are very important for successful implantation. Implantation is presented in the form of a successful pregnancy. So for a successful implantation, along with the good quality endometrium and a good quality embryo, it is the interplay which happens between both of them which is responsible for a successful pregnancy, which is detected initially in the form of a blood test which is known as beta HCG. So these are the main steps which occur in an IVF cycle. So now whenever one or multiple IVF cycles fail, we generally try to find the cause so that it can be rectified, if at all the cause is identified. So generally the causes are differentiated into maternal, embryologic and multifactorial or mixed causes. So first is the maternal causes. In maternal causes, these are generally the causes which are related to the mother or the female patient. So the first of them is the age. So as we already know that age is the most important factor in a female partner, because as the age advances, the quality and the quantity of the eggs which are present in our ovaries, they go on decreasing. Generally, this is more rapid after the age of 35 years. So whenever a woman less than 35 years of age undergoes an IVF cycle, the success rates are better as compared to the women who are more than 35 years of age. Along with this, in general, the probability of getting pregnant after the age of 35 years is lesser as compared to the women who are less than 35 years old. So age is an important factor. The next important factors are related to the uterus of the mother or the female patient. So generally the problems can be in the form of septum. So septum is generally a partition which is present in the uterine cavity. It can be a partial or a complete septum. Generally the partial septums can occasionally be missed on a transvaginal ultrasound, and it might be the reason for recurrent implantation failures. It basically causes failure of the implantation due to the reduced blood flow to the embryo. So that is one of the reasons. Other than this, there are certain situations like presence of endometrial polyp. So endometrial polyp is generally an outgrowth of the endometrium, which if it is present at the site of implantation can definitely hamper the successful implantation of the embryo. Also, sometimes presence of small submucosal fibroids which are missed on a transvaginal ultrasound can also cause failure of implantation. Other than this, there is something known as intrauterine adhesions. So intrauterine adhesions are basically the bands which are present inside the uterus. They basically hamper the growth of the endometrium and eventually the implantation of the embryo. So these are the problems which are related to the uterine cavity. Other than this, there is something known as hydrosalpinx. So hydrosalpinx is a situation of the fallopian tubes. In this, the fallopian tubes are swollen and they are filled with fluid. So generally this fluid, it seeps into the uterine cavity slowly, and it is considered to be having embryotoxic properties, and it is one of the major reasons for recurrent implantation failure. So whenever any of these reasons are treated, there are better success rates in terms of pregnancy and implantation for the patients with recurrent implantation failure. Other than the uterine factors, there is something known as endometrial receptivity. Now, endometrial receptivity is a very important factor for a successful implantation. So the problems related to endometrial receptivity can be detected with the help of a test which is known as ERA. So whenever a patient presents with recurrent implantation failure, but the patient is having good quality embryos, the problem related to the endometrial receptivity can be suspected. So these are mainly the maternal causes. Other than this, there is something known as thin endometrium. So generally the required endometrial thickness for a successful implantation is more than or equal to 8 mm. If there is chronical thin endometrium which is less than 8 mm, then again it is associated with recurrent implantation failures. So these are the causes related to the maternal side. Other than this, there is something known as the embryological causes. The embryological causes are related to the embryo or the gametes, which are the eggs and the sperm. So for a good quality embryo, good quality egg and a good quality sperm is very important. The quality of the embryo is generally decided based on its stage, the number, and the day on which the transfer is done, whether it is a day 3 embryo or a day 5 embryo. So for this, a good quality egg and a good quality sperm is important. To assess the quality of the eggs, it is generally done only after the oocyte retrieval. The morphological assessment of the eggs can be done only in the labs. But in terms of sperm, we generally do semen analysis. So when we do a semen analysis, generally it is the sperm count, motility and morphology which is considered, which are considered as the important parameters to assess the quality of sperms. So that is about the gametes. Other than that, certain chromosomal or genetic problems which are related to the embryo can also be one of the causes for recurrent implantation failure. The next is multifactorial or mixed causes. In this, the patient might be having both the causes, that is something related to the maternal side and something related to the embryological side, which is one of the reasons causing recurrent implantation failures. So whenever there is a patient who is coming to us with recurrent IVF failures or even one IVF failure, the most important thing is to go and find out the correct history of the patient as to what was done in the previous cycle, what was the protocol which was used for the oocyte retrieval, and eventually what was the quality of the eggs which were retrieved, what was the how were the embryos formed, what is the quality of the sperms, and what was the day on which the embryo transfer was done, and how was the endometrium. So what was the thickness, what was the pattern, how was the blood flow of the embryo. So a detailed study of the previous IVF stimulation cycle can give us an idea about how to proceed ahead in the next IVF cycle. Now, what are the management options which are available in patients with recurrent IVF failures? So the first and the most important thing for the couples would be not to lose hope, because one IVF cycle doesn't mean that the eventual failure doesn't mean that eventual IVF cycles will also fail, and there is definitely always hope as to if we find the reason and if it is treated. So not to lose hope is the most important thing, and psychological counseling is very important for the couples because it can help them gain the confidence which they have lost maybe after the IVF failure. So that is the first step. Next is we generally try to investigate and try to treat the causes whatever is found. So on the maternal side, as we know the causes, so if it is related to the septum or the endometrial polyps or submucosal small fibroids or intrauterine adhesions, all of these can be diagnosed only after a diagnostic hysteroscopy. So whenever an IVF cycle or an embryo transfer fails, generally the next step would be to plan a diagnostic hysteroscopy just to have a look on the uterine cavity. Hysteroscope is generally an instrument which is having a camera. So this camera is passed inside the uterine cavity to have a look as to whether everything is normal or if any of these situations are present. So if any of them are present, like septum or polyps, submucosal fibroids or intrauterine adhesion, they can be treated with the help of operative hysteroscopy after diagnostic hysteroscopy. So that is how they are managed. Now the problems related to hydrosalpinx. Hydrosalpinx are generally detected on an ultrasound, and if they are present, then they can be removed laparoscopically by clamping them at the uterine end so that the fluid doesn't seep into the uterine cavity, or they can be completely removed. There is a good success rate after treating the hydrosalpinx or removing them in patients who have previous history of recurrent IVF failures or recurrent implantation failure. Then next is the problem related to the endometrial receptivity. So in patients who have a problem related to endometrial receptivity, where we have good quality embryos, but there is failure to implant, generally problem related to endometrial receptivity is suspected. So in such cases, there is a test which is known as endometrial receptivity array or ERA is performed. So in this test, generally the hormones are the hormonal medications are started from the second day of the cycle, which is initially estrogen, so that the endometrial thickness increases. Once the desired thickness pattern and the blood flow have achieved, we start the progesterone medications, and generally on the 5th day of starting the progesterone, some endometrial sample is collected transvaginally without any anesthesia if not needed, and the sample is sent to the genetic lab for genetic analysis. The report generally takes a period of 10 days to 15 days, and the report is generally available in the form where it suggests either receptive, pre-receptive or post-receptive. So receptive generally suggests that this is the ideal time to do the embryo transfer. Pre-receptive is that you're planning the transfer after the receptive phase is gone, and post-receptive is you should plan it a bit earlier. So that is how the report of endometrial receptivity array is given, and there are cases where success rates have improved after planning the embryo transfer in patients after ERA. So this is how you can advise personalized embryo transfer to the patient. So that is how the endometrial receptivity problem is addressed. Other than that, in certain patients, there is always this problem of thin endometrium, where the endometrium doesn't grow beyond a thickness of 7 or 8 mm. In such patients, other treatments like intrauterine instillation of GCSF or intrauterine PRPs or endometrial scratching can help in improving the endometrial thickness, because they eventually improve the thickness and the endometrial receptivity. So that is the maternal side, how it is tackled. For the embryological problems, like if there are problems related to the oocyte quality, so as we said, age is the most important factor, but it cannot be rectified. So the other things which can help in improving the oocyte quality is some lifestyle modification, like stopping of smoking, alcohol consumption to stop. Other than that, certain form of exercises and use of antioxidants can improve the egg quality. If the male factor or the poor quality of the sperms is suspected to be the cause of poor embryo quality, then other than semen analysis, DNA fragmentation is one of the important tests which should be performed. So if the DNA fragmentation index or DFI is more than 35%, then it is associated with poor implantation rates. So generally for poor DFI, we try to find the causes as to why the DFI is on a higher side. It can be due to infections, varicoceles, diabetes mellitus. So these things can be treated. And other than this, the medical treatment in the form of antioxidants could be given to the male partner to improve the DNA fragmentation index, so that we can retrieve good quality sperms. Other than this, there are certain newer advances where higher magnification is used to select a good quality sperm, or magnetic field is used to select the sperms which have less DNA fragmentation index. These sperms can be used to perform the ICSI and eventually to form good quality embryos. So that is about the sperm parameters. Other than that, certain chromosomal or genetic problems which are related to the embryo can be tackled with the help of a test which is known as PGT, or pre-implantation genetic testing. So whenever some chromosomal abnormality is suspected in the embryo, this test is performed. So in this, basically the embryo is allowed to grow up to the 5th day, that is blastocyst, and some trophoectoderm cells or some cells from the blastocyst are collected. These cells are known as blastomeres. They are sent to the genetic lab for genetic analysis. Again, the report is available in a period of 10 days to 2 weeks, and the report is generally in the form where it is suggestive of the genome is normal. So the genome of the embryo is normal. If it is normal, then the embryo is good for transfer, and if it is abnormal, then the embryo should not be transferred. So that is PGT, and this is how the chromosomal problems can be handled. And other than this, there is something known as assisted laser hatching. So sometimes there is problem in the implantation of the embryo due to thickening of the zona pellucida. Zona pellucida is the outer covering of the embryo, which ideally should not be very thick. And so with the laser hatching, we can do thinning of the zona pellucida, which can help in better implantation rates. So whenever the problem related to recurrent IVF failures is seen, or the patient has a history of recurrent IVF failures, the first and the most important thing is not to lose hope. The patient should be counseled in a correct manner, and we should try to find the causes depending on the patient profile, and depending on the patient history, depending on the previous stimulation protocols, and depending on that, the eventual treatment is planned, which should include almost everything: the financial condition of the patient, the time duration, or the time constraints which can be there, along with psychological counseling. So that is how we can handle cases with one or multiple IVF failures. Thank you.